CareAsOne is committed to providing a unique virtual collaborative experience for healthcare professionals to come together to exchange information about U.S. healthcare through collaboration, conversation, and knowledge sharing. The Future of Health podcast provides a true infotainment service that helps the industry innovate by sharing expert voices, views, and advice on the important issues of the day. And now here's your host for The Future of Health, Dipty Desai.
Hello, everyone. Welcome to The Future of Health with CareAsOne. I'm Dr. Dipty Desai, the director of CareAsOne and the host of this podcast series. And for those of you who are new to CareAsOne, it's a large virtual community that jumpstarts innovation acceleration by bringing together various stakeholders in the care cycle. From providers to payers, pharma to clinical researchers, startups, investors, universities, and more. The mission of CareAsOne is to truly accelerate innovation by creating a connected healthcare community where the patient is at the center of care. This entire ecosystem comes together through knowledge sharing with the help of healthcare luminaries and thought leaders like the one you will meet today to discuss the challenges, the gaps, the solutions, and transformations that are essential to make healthcare whole again. The interaction and networking between the stakeholders is made possible through the community via our summits, webinars, roundtables, CXO circles, and podcasts. And in today's podcast episode, I will be talking to the Senior Vice President and CIO of Bronson Healthcare, Ash Goel. Ash's expertise lies in strategic leadership, technology development, innovation, and analytics. And I think that Ash really likes to focus on health innovation. He encourages entrepreneurship and new business model adoption. He truly actually is a doctor by training and has had many years of industry experience, almost 35 plus years, where he has contributed to few major developments in the healthcare industry. Ash, your journey has truly been visionary and inspiring to many of us. And so to begin with, can you please share some of the highlights and tell us about some of the exciting work that you're doing today?
Thank you. Appreciate the opportunity to be here, and certainly very much excited about the conversation that we are going to have today. You pointed out to the reason why we get together, which is to talk about how complex healthcare problems can be solved when we come together. I think I was feeling old when you were talking about the things that I've tried to do. It does take a lot of time, and it does take a lot of patience and a lot of learnings to get to where we're trying to go. And the journey is even now just at the beginning stages of where our tasks are leading us. And I have been in healthcare, as you mentioned, for a long, long time. And I started really out as a physician, and I still practice medicine and acute care as a hospitalist in a couple of the hospitals that I work with and work at. I really have been very fortunate to have worked with great mentors and great inspiring visionary people such as yourself to understand the bigger picture and to learn what we can do about the challenges that we face every day. And along that journey, I've had the opportunity to take care of patients, take care of families, be involved with initiatives small and big, learn about how we have so much to do about opening up and bringing in diverse views into how healthcare is designed and delivered to the wider community. I moved to the US about 25 years ago. Can't remember how long ago was that. My training in medicine was in New Delhi. And I became an accidental leader more than anything else. when you ask too many questions, sometimes you get handed the problem to solve. And I was fortunate to have had that opportunity because it helped me shape who I was going to be, who I am, and what I want to be. The path to that really was about realizing that I am going to become more effective and broaden my horizons around how I impact healthcare delivery, not one patient at a time, but as organizations that can come together to make things better. I started out with information technology roles, and I have continued to gather more information and more knowledge. In the world, information technology is a misnomer. Right now, I think information technology is uh, as much about operations as it is about delivery of care, as it is about
True.
IT. Yeah.
It's all coming together. Yeah.
Think of it as the nervous system of any organization, healthcare, or even our homes. When was the last time you did not depend upon technology in your home to do anything? So I'm excited, and I am always looking forward to learning and see where this conversation takes us.
Yeah, no, I mean, you nailed it. It's technology is like become the nerve center for everything that you do. And that was not quite the case, maybe even 15, 20 years ago, right? Technology innovations have improved quality of patient care. They've given patients a broader access to their medical records. The scheduling has seen technology infusion. We've developed safer medical procedures and diagnostic tests, and even clinical studies is going the technology way, right? So we are using technology to gather patient data, analyze it, apply it in new ways. And you are one of those people who's doing this, right? It would be great for the audience to learn how are your using the technology in healthcare. What are your views on technology in healthcare? And how are you doing it all to manage your hospital systems that are like, as you mentioned, it's like not just you're working with a lot of different hospitals, right? And you have to put them all together.
Yeah, no, absolutely. There's certain core principles to what I think of when I look to technology to solve fundamental problems in healthcare. One is about information gap. Second is about access to information sharing and transparency around information. And the third is around how we intelligently deploy that information to where it is needed. And then I would say perhaps the most important of all of this is to be open to understanding how it can be done better every step of the way. And that's where innovation or the idea of innovation comes in. Because innovation doesn't happen from the center. Innovation happens from the edges.
Yes.
And to make that happen, to make an ecosystem that allows for change, you have to be open, you have to be transparent, you have to be connected, and you have to be willing to change. I think of these as paradigm shifts that start at the periphery, but then they become waves unto themselves that change how we become what we are now. I imagined 25 years ago when I started down this path, having access to patients' information on computers was about labs and x-rays at best. Everything was on paper. I used to remember waiting for paper chart to come back when the patient had come back from an x-ray in a hospital, or you go to the doctor's office and you had this huge, humongous filing cabinets that you're wading through to get access to records. Right? That seems so old. That seems so ancient nowadays. We have tried to follow those principles that I just talked about because if I can't move forward even in the area that I manage in a smallish system out in Michigan, then how am I going to go broader than that? How am I going to go impact the state or the region or the country? We have been fortunate to have had a vision around how we connect communities and how we exchange and share information. And we have very thoughtfully and methodically continued that journey, whether it is through just building completely integrated data systems internal to our organization, or it is about then taking the next leap to offer that as an open architecture to our community partners, our business partners in and around us. Or then taking from there to being very open and very transparent for our patients and their family members to have access to that information. And not only have access to that information, but have it in a very time effective and a very meaningful way. Now, I'm not going to say that we have solved it completely, but I'll just quote some numbers for you. About 98% of clinical data that is patient facing in our system is available to our patients through our patient facing websites and apps. And it is available within seconds of it being available to the doctors. So there's no delay in a result being published from the lab into our EMR to it being published into the patient's hands. There's no gap in how the patient who, for example, I've given just a recent, fresh example of how the communications have been changing. And I was working this weekend in the hospital, was taking care of some patients who were in our initial observation area. We call the admission unit. And there was a lady who was admitted after having fallen and passed out about 3 times at her home in the last 1 week. A couple of her family members were in. And I was just walking into the room and was going to gather some information from the patient about the events that happened. And the patient's 2 daughters, these patients are elderly. They were on their phone. They were looking at what actively was happening in terms of they knew what orders I had placed. They knew the patient was going to get an MRI, an EEG. They knew before I did that the results of the echocardiogram that had been ordered the night before are available because I did not yet have the chance to look at the record. Okay. And that was fascinating to me, not only because of access to information, but also about how that changed that conversation that I was having with that patient and the family member, because I could explain to them why we are doing what we are doing, what to expect, and what our plan would be for the next few hours, next day, or next 2 days. Fast forward, that day was done, all the information that we needed to gather was done, and I followed up late in the evening with the patient and the family, and they said, this is the best experience we've ever had in being able to take care of not only our medical needs, but also our communication needs. Because everything happened the way you said it was, everything was available to us the way you said it was going to be. And I was able to send the patient home, get them their next appointment. They knew where their next appointment was, and it was over the weekend. They still were able to have, they walked out of the door with an appointment to go follow up with their cardiologist, get the next tests done and everything else on a weekend. I could not have imagined that having happened in the world without technology.
That is it. You said it.
So
technology in action right there, right? And you said so many profound things over here. I don't even know what to mention, but innovation happens at the edge, and then you need to bring it to the core. I mean, you give examples of dossiers to this technology infusion, 98% of the data being available to the patient within seconds of when it's available to you. And now you have an informed patient that allows for a better patient experience. And all because of this transformation through technology. So, I mean, so true. And really, healthcare and this pandemic had showed how unprepared we were to deal with the crisis. It showed that we really needed that infusion of technology, that transformation. And it actually identified so many deficiencies in our system that many of us, you especially, have taken care of and have shown that transformation just by your previous example that you gave, right? And you mentioned that, while we've done quite a lot, there's still a few things that need to be done, right? So if there is a place that you think we need to do, still you were seeing some deficiency, like can you name like one place where we would like to see a change that still has not happened?
Oh, absolutely. I wouldn't say not one. There's probably hundreds of places that we can name that'll make things so much easier, better, and more efficient. And I'll start with the first one, perhaps, and then see where that goes. Our systems, our technical systems, and our data systems have not been designed to be centered around the patient. They have been designed to be centered around the delivery systems, the doctors, the payers, the medical device manufacturers, the pharmaceutical manufacturers, and everybody forgets why we are doing the work we are doing. We like to hold on to our data, and we like to center the flow of that data around ourselves and not around the patient. How hard it is for us as individuals, as patients, to know what does it cost me to come to a doctor's office. How challenging it is when you have a prescription that your doctor just sent to your pharmacist, and the pharmacist in that pharmacy said, sorry, I don't have that, but there may be something else that you can take, but I'll have to talk to the payer or your insurer to find out what substitutions we need to make. But oh, by the way, I cannot do them because our pharmacy doesn't have that, or it is in short supply. So we'll have to transfer your prescription, but I can't do that for you. You have to go talk to your doctor's office to send the prescription again to this other pharmacy that may have it.
Classic.
I think I can go on miles and miles of things that are broken with our system.
I mean, you said it, the data exists. They exist in silos. It doesn't interact to one another. The systems are not interoperable. And it's unfortunate because at the end of the day, the patient suffers, right? Because and everybody has a good, means well and wants to do the most that they can, but our systems need to be, I don't know, overhauled or transformed in their own way. So it would be great to see.
I would say it is about centering it in the right place. It's you were talking about innovation, and I'm sorry I'm interrupting you in there, because we've taken away the power of patients and individuals because we formed these giant behemoth organizations that control the flow of dollars through the system. Why is a consumer experience and I'm not saying that it is perfect, but it is better in a retail shopping experience online, or in a pick up a ride in a city at your convenience. Right? And I say that because the approach in that ecosystem has been creating technologies that are centered where the demand is generated and where the demand is anticipated. Right? In healthcare,
yes,
we wait for the person to get sick, and then we want them to come to us. We want them to beg to be seen. We say, well, you want to get it seen, you're going to make an appointment with us. And before you make an appointment, you go to your insurance, make sure you're covered. You want to make sure that you have paid all the things you needed to pay us. And we will see you 3 weeks from now, although you need care
now.
today, maybe tomorrow, right?
So true. So
So
true.
access, I mean, the first point we get to is we create barriers. Will Amazon or Uber survive by saying, yeah, we'll come pick you up after your late evening movie, but we'll do it tomorrow.
Ah,
Make an appointment with us.
yeah, no, access to care has been not easy. And, we always say that maybe the better way to do it is not for the patient to come to the hospital, but for the doctor to see the patient at home. But that's also not that easy. Maybe we can do remote care management. And that was not gaining traction either till the pandemic hit. And then we said, oh my God, we can't see these patients at our hospitals. They're all sick. Let's see them remotely. And that actually played a big role, that traction that we saw. I mean, what do you think? Has this change come to stay? Do you think we'll revert back to our old behaviors once this crisis passes? Or do you think, the regulations have changed enough that we can now tweak and use more technology and telehealth, telemedicine, tele everything will become more prevalent?
Yeah, I think you're spot on with all those comments that you just made. The learnings from the last 2 years have definitely moved the needle. Now, the needle has swung back some. The story is still being written about how the regulatory changes will come to stay. I cannot imagine that the regulatory changes will swing back all the way, because that would be just, well, I'm going to say it will be asinine to do. The behaviors that have shifted, I think, will shift back some, but not to where they were at before, both on the patient and the provider side. Because humans want to look at change only in increments. You will still see resistance both from the doctors and from the patient. Like, well, I need to go see my doctor in the office. I don't know about this little video thing that you're talking about. Right? Nobody talked to me. Nobody touched me. Nobody did an examination on me. Little do they know that sometimes doctors don't even hear what they're trying to hear with their stethoscopes. Right? I think that's where innovation's gonna come in, because the connected devices, the home-based hubs of information that are not only proliferating, but indeed need to become much more sophisticated. And I think the technologies are coming there. All the improvement in the infrastructure, the improvement in ability to connect to high-speed data lines, whether it will be through 5G or wired connections, and people's behavior and comfort that is changing with use of technology. My parents are in their upper 80s, and they live in Canada. They're not shy of using their iPads and their iPhones. We stay connected with them all the time. And the last year and a half, most of their care has been virtual care through their doctors. And I'm happy with it because they didn't have to go get exposed to the Omicrons and the Delta waves, right?
No, I mean, so true.
So,
Yeah.
I think that's where we are at. And I think I'm glad that we are there, because that's exactly what we're talking about, right? Change comes from the peripheries. And the other thing that, I think I've mentioned this in the past conversation. I was talking about the 3 Ps that I use in our conversation. It's about the proximity of demand. The example being go to a patient's home or go to where the demand is generated, the peripheries, which is where the change happens, and then the paradigms, where the paradigm shift happens.
Yeah.
You just automatically talked about all those things. I didn't make them up.
I know. Our healthcare system is filled with the P's and providers, the payers, the pharma, the patients, and like you
That too.
mentioned, process and programs and people. That's what makes a healthcare system better, right? I mean, so actually, going back to something that you mentioned is that getting the right information to the patient at the right time is very crucial, right? And that lack of communication can delay diagnosis and treatment. And sometimes, like you said, the patient doesn't get an appointment for 3 weeks, but the person has chronic care conditions. We need to actually be looking at them not only at a snapshot at a time, but also longitudinally. And all of this is all boils down to communications, the frequency of communication, and that is evolving too, right? And would love to get your thoughts on how can, especially I think most of the cases seen are on continuous care management and also chronic conditions. That's where most of the cost goes, right? How can this be changed or be made more efficient, and can technology play a role here? How can you any thoughts, suggestions on how we can make this better?
Yeah, I think that is the other crucial problem with how the economic model of healthcare works, at least in this part of the world. Longitudinal care and chronic care management is so important to prevention of illness, promotion of well-being, and beyond that, the ability to reduce costs. It comes from the whole idea of going upstream and not waiting for things to break down before somebody has to seek care. The current majority of the healthcare system models are based on transactional fee-for-service activities. You come to see the doctor or the hospital can bill you for the care, and then you go on and everybody is happy. There's been continued evolution of what has been called value-based care or chronic disease management or risk-based care management and things of that nature. I think there is a lot left to be done in that space. And the biggest challenge in that space around longitudinal or chronic disease management is exactly what you mentioned, which is about the ability to tell the story of the patient from these individual episodes to an episodic but connected journey that the patient has had for the last how many so years, whether they went to one doctor or one specialist, one hospital or the other, or the urgent care center. For the last 20 years, I've been involved with this incessant need for us to do something very simple, which is to figure out what medications is this patient on when they come to see either the doctor or when they come into the emergency room or when they get discharged from the hospital. We've put people resources on it, we've put technology on it. I haven't been able to solve that problem. You would think it is very simple, but it is not. And here's why. Right? The patient comes in, say, to the emergency room. They don't have the list of medications that they take. So the doctor in the emergency room or the nurse in the emergency room tells them, can you remember what you were taking? Okay, I'm taking A, B, and C. They put that in the system. They get admitted to the hospital. They're sick. They get 5 different other medications. They go home with a list, which is kind of a combination of what we thought they knew they were having and what we give them or prescribe to them. The patient goes home with their list. They go to the pharmacy to get a prescription. The pharmacist says, yeah, that one doesn't get covered by your insurance, so I'm going to change it to this. And the other one, you were never taking that. What do you mean? No, your medicine was that. Okay, so the now patients got confused list of things. And then they go home, they go look through their medicine cabinets, and they find 3 other medications they were taking that weren't on any list. And they were duplicates of what they were discharged on from the hospital.
Yeah.
And then they start taking more of those. And then they come back to the hospital more sick than they got discharged with.
Yeah. I mean,
30% of discharges from the hospital have medication errors because of medication reconciliation.
Yep. Medical adherence and forgetting to take the medications on time, and not that they don't want to, maybe side effects sometimes, and sometimes you just forget. So many things, and the chemical imbalances and the triggers they cause and the complications they cause I wish there was some way of just monitoring all of that and reminding people to do what they need to at the right time. I actually wanted to bring up one more very interesting point about your career, where you mentioned that you have been in the US for many years, but before that, you got your training in India. And, that's a little unique compared to most of the other people over here. And these two healthcare systems, US and India, are very, very different, and you've thrived in both of them. I would really like our listeners to hear, what did you like about the US system and what did you like about the Indian healthcare system? I'm sure there were positives and negatives in both. So what did you like about each and what did you not like as much about each? And what can one system learn from the other? I think this would be really interesting.
Yeah, I'll speak to my experiences, although a long time ago, with the Indian healthcare system. I worked in a very large urban academic health center in New Delhi for a little while. And what I appreciated and enjoyed about practice of medicine there was the degree of involvement and accountability that both the patients, their families, and the healthcare workers took in trying to take care of the patients was just amazing. The ability to deliver care, even though it was constrained, was still very satisfying because the people who were looking to get the care really A, needed the care, and B, appreciated the care that was being given. It's about a problem of plenty versus a problem of, do I really need the care that is being offered to me? And what I mean by that is, here in the US, I go to a doctor's office and I say, oh, my back is hurting. It'll be almost impossible for you to walk away without a test or an MRI order because that's the expectation. You do the same thing in a third world country or in a large urban city like New Delhi. They will tell you to do some exercises and go home, and in 6 months, if it is not better, come talk to me. And about 90% of people get better. So it's about appropriateness of care. It's about expectation of care. That's not to say that I don't have positive experiences about healthcare here in the US. The access to care is phenomenally better than what it has been in my past experiences. And I've worked in 2 other countries besides India. And the other thing that I think is very humbling and very important is that there is this openness to explain and understand what is happening. I think doctors are not gods. Sometimes they get treated that way by especially patients in India. Being able to explain what is happening and being able to understand what is being done, it is just an entirely different conversation that you can have. Certainly, access to technology, access to resources, ability to take care of things the best way that you can, because our training is always been about how you can do so. So those are the kind of things that I've really appreciated about in my opportunities to be able to practice medicine in the US and then lead organizations in the practice of medicine and improvement of quality, improvement of experiences, and improvement of care. That's what I've enjoyed about what I do.
That's right. It's been a sea change in healthcare, even during your tenure in the US, and how it has evolved. And what has come to the forefront is that, cost and healthcare, it's one of the most major deciding factors for patients to for treatment, right? And technology is making it more efficient. But not only that, I think business models are also evolving and to bring in these efficiencies. And you have come in contact with both of these. Like, how do you contain costs but still provide excellent care? And what can you do to change the way we are delivering care, the business model of care? I know we have very little time remaining. It would be great if you could address these 2 points and tell our viewers and our listeners, like, what do you think the future of care will be, and how will the business of care change, and how will we manage the costs?
Yeah, I wish I had the crystal ball to say that I could solve both of those, or at least even give us a window into what next 5 years will look like. But at the risk of being absolutely wrong about any prediction that I make, the two things I think that are going to happen are the control of information as it continues to move out of the hands of the doctors, the hospitals, the payers, the pharmaceutical industry, and more accessible for patients and families. And then the power of data that is being gathered in people's homes through connected devices and wearables is going to continue to make it more transparent, more open and accessible to the patients and their families. And I think that's a trend that I'm glad and I highly doubt will ever reverse. We've seen that as the fundamental and the force multiplying power, good, bad, or indifferent, for technology. Social media being an example. Right? News doesn't travel once a day in a newspaper that you receive in your home physically. News travels in an instant from one corner of the globe to the other. So I think that is something that will continue to evolve and continue to improve, and it will continue to shift the ability of consumers of healthcare to have more say in how they consume it. And I think that will, by itself, start forcing the change in the economic models of healthcare. Because when I can ask the question, well, why am I paying X for this and Y for that? And why does somebody else charge me this when I could go do that in somewhere else cheaper? It's going to start creating an imperative for all parties.
No, you said it right. Transparency of cost is very important in healthcare. Why should the same thing cost different for different people with different accesses, right? And that needs to be solved for sure.
Yeah, it is, and that's what is going to shift. Ultimately, the power of the consumers. It's not going to be regulated or governed. That's where things are going to change, and that's what's going to drive. If I am buying a car, I want value for the car. If if I'm buying wellness, I want value for that wellness.
I think we've got this problem of plenty. We have so many different insurance companies to choose from. We have so many different providers to choose from. Many countries and many people don't have that luxury, and there are pros and cons to both. But that's a whole another conversation we should have. There's so many areas that we just briefly touched upon: interoperability and data silos, to patient experience, to models of care, and each one of those could be a different podcast topic. And we hope that we can have you again to discuss some of these more in greater depth than just that one topic alone. So thank you, Ash, for taking this time to chat with us and sharing this knowledge, immense knowledge that you have on this whole evolution of healthcare. It was really a knowledgeable session for all of us. And I'm sure your advice is going to stay with us throughout this transformative journey of the healthcare sector. And to the audience that we have today, thank you for listening. Don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned for more CareAsOne podcasts and discussions and webinars on trending healthcare topics that you care about. And send in your suggestions on speakers and topics, and we will try to address them. Thank you. Thank you all.